This week on Dr. Drew After Dark, your taint is burning. Yes, it is.
It's not a voice.
Any, bad outcome of someone else's urine being in your butthole or vagina hole. Yeah, that's pretty much it. Piss on me, literally. Yeah.
I think I'm in love. Welcome to Dr. Drew After Dark. Please be advised that Dr. Drew After Dark may contain sexually oriented content and be unsuitable for young children. Hey, everybody, welcome to Dr. After Dark, 818-253-1693 for those voice messages, and Dr. Drew After Dark at gmail.com for the emails, which we have tons of both to get into today. No guest today, just me and the booth boys. Yes, gentlemen. Nice. This will be great to spend a little time with you guys. Let's see. What do I have to get into? So it's, Chad, Annie, and Tanner in there today?
Yep.
All right.
You got it.
And as I've said before, Tanner is the new Zolo. You're going to destroy this young man, but okay, And Eddie, you say no, huh? You're saying no that we didn't destroy Zolo? I beg to differ.
That we didn't destroy Zolo. Nah, man. Zolo's a self-made man.
He came preloaded the way he is now?
That's correct. Yes.
So let me ask something. I noticed today, we got a lot to talk about. And we'll get to calls, I'll get to everything, I'll get to all the stuff, and support people, support us, and check out DrDrew.tv and all those good things. I appreciate you guys always. We love your mom's house crowd here. And by the way, if you ever want to get at me, contact at drdrew.com is where you can reach me. I got a strange energy in the house today, something like that. Is that possible?
Well, from what?
I don't know. In that, I noticed when I would ask Zolo questions, he'd start shuffling around a little bit, sort of look off, wouldn't address me directly. Is there something in the air here at your mom's house? Something going on? Something I missed?
There's definitely something missing.
Well, that's the other part I want to talk about. Isn't the Nadav's missing, right? You and I have not really discussed that. Yeah. And I spent 2 weeks reassuring people that he wasn't dead. I thank you for that, guys, because people were really like, I get, sorry for your loss. I was getting DMs and all kinds of things for a while. So thank you for that. And I saw Nadav at the Skanfest. He was there. I actually did one of the, these slots I was supposed to do with Adam that I had to go up with other people that I could find around the Skanfest. Potter and I went up for a few minutes. And at that evening, I said, look, there's the two first guys I ever met. You were actually the third guy. But the two first guys I met was Nadav, who was sitting over here, and Potter, who was on stage with me. And that was my, other than the Tom and Christina things I'd done a couple of times, that was where it all started for me with your mom's house. So how you guys doing without Nadav around? How's your Hebrew?
Chamesh.
Stein.
Yeah.
Shalosh.
It's obviously a lot different around here.
Yeah.
A lot quieter. It's a big change.
And he seemed happy, by the way. I saw him in Las Vegas. He seemed great. And is he happy? I noticed he's also on the wall, which was fantastic, in your mom's house studio. He's in the gallery of does that gallery have a name?
It's got a cool guy portrait.
Cool guy gallery. It's got a cool guy portrait. That was done fast. All of a sudden, he's on the wall there, where
our painters work day and night.
Yeah. But by the way, at the Skanfest, speaking of painters working day and night, I'm blanking the name of the guy that did the murals here. You guys
Chris Rogers?
Chris?
Mm-hmm.
I wanted to say Charles. Chris was at the Skanfest doing portraits of people as they spoke. It was great to see him.
Yeah, man. He's everywhere.
He's amazing. What a great guy.
Shout out to Chris Rogers.
And I don't know if people do they know about the murals here? Do you guys talk about it?
Mm-hmm. Yeah, we made a post.
And they're incredible. And he finished this one now, too, I noticed, which is great.
Yeah, he just finished the last one, which is Rising Phoenix. That's like his... I don't know. I mean, I guess I don't want to speak for him, but it's a big piece for him that he finally brought into like a bigger space. That was on paper before.
Oh, no kidding.
He then imagined in that big space, and it's fucking awesome. And he's still got one more to do. He's going to do the wall that goes right into the studio for
Over here.
image. Yeah, right next to that. So
what's he gonna do
he's
there?
got some cool ideas.
Yeah.
I mean, I wish I could. The way, when he explains what he's gonna do, it always sounds so dope. And then if I try to re-explain that, it's
I
like,
get
I'm
it.
not an artist. I can't.
Yeah, he's a true creative genius. So everything good with you guys? Any questions? Anything coming up? Everything? Nothing's weird here. Everything other than we're adjusting to Nadav not being here any longer. Is there anything else going on?
I mean, no, yeah. I mean, I'm chilling. I got heartburn right now. This is one of the only times I've ever had.
Well, why don't
heartburn,
you just will it away, my friend?
Yeah, I'm working on it. It's
will
a
it
new
away with
thing.
some Pepsid and some Gaviscon. That will will it away very nicely.
Drew, you said on one of the episodes that like the long-term effects of so I take omeprazole.
Oh yeah,
pretty much daily,
which is Prilosec, essentially.
What's wrong with that?
Well, it has been associated with tumors of the pancreas, and early on that was a concern about it, and I sort of always kept that in the back of my mind, though we've really not seen much of that, and obviously it's widespread use now. Also, here's the thing that more recently came up. It's associated, long-term use of that is associated with dementia.
Sweet.
So, sweet, exactly, Chad, just what you need. So, and by the way, and Zantac I always knew was a shitty drug. Now that's off the market. Pepsid has always been a good drug. It's just an antihistamine. Works great, simple, nothing. Why don't you just take that?
Those don't really work for me. They're like a little too, they're like they're fast acting, but they don't really address the issue. I feel like the other ones, the daily use kind of ones do. Pepsid
you should take every day. I take it every day.
Okay.
I would never take the other ones every day. Although I've taken it for a few weeks at a time. I have gastroesophageal reflux, right? I have to get upper endoscopies every year. Have you ever had an endoscopy?
Which one is that?
Where they look down with the scope from above.
From your nose?
From your mouth. Or you're asleep.
I've had them go look at my vocal cords for that through my nose.
Yeah. And did you have reflux there? Is that what they saw?
Yeah.
Yeah.
And it was awful.
What do you mean? Oh, having the procedure was awful?
Yeah. Yeah.
Yeah, good times. I'll tell you what, I just think if you're going to take something daily, Pepsid is a better thing. And then when you get breakthrough, then use the omeprazole. Okay? That's what I would urge you to do.
Wait, breakthrough? What do you mean?
Meaning if in spite of the Pepsid, you still have some symptoms, then you add the omeprazole for a couple of weeks and then go back to the Pepsid, that kind of thing. Some of the medicines are really inert. Some of them are like, probably inert, but we're not sure. And definitely, in my humble opinion, omeprazole is one of those medicines. So what was the weird energy I was picking up on? Was there something, really? Are you guys just not talking to me, or is it is I just my brain?
No,
or just things are different here
without
Nadav.
Yeah, it's different without Nadav. A lot of people are out of town right now, so there's only a few of us in here, and just shooting a lot, basically.
Shooting a lot of
shows and whatnot.
So everyone's busy. That's what I'm picking up?
Yeah.
Okay, so and here I came in from out of town to do a show or shows, and I'm intruding on all that. That would make sense.
No, you're part of the.
I am, but I'm breaking your stride. You guys have a certain thing going on right now that I'm dropping in the middle of.
No.
I don't know. It's weird energy.
This is the show.
Well, I'm just saying, there's just a weird energy. That's all I'm saying.
Like I said, man, I got heartburn. I've never got heartburn, so.
You caught it from Chad. What can I say?
I caught it. But it's contagious. Damn.
But I'm rarely wrong about things I feel, and I feel the weird energy. I don't know. I don't know what it is.
You're not wrong, Drew, but it has nothing to do with you coming in.
Oh, well, what does it have to do with?
I mean, everything we were just talking about.
Being so busy.
Yeah.
Okay. I literally felt like I'd walked into a group that had been yelled at by their mom or something, and it's really what it felt like. And everyone is, and you guys are sort of dressed down, embarrassed, don't want to talk about it. No, nothing like that was going on. No. Okay.
No.
All right. At least nothing we're going to talk about. Well, speaking of talking, let's go to a call. This is Alden.
You're so paranoid.
No, I'm not paranoid. I just know to trust my instincts. I know when stuff occurs to me that has nothing to do with me, I know to listen to it. That's all I'm saying. Alden, what's happening?
Hey, Dr. Mommy. It's Aiden.
Aiden, I'm sorry. I looked like an elder.
Hey, no worries. So I'm a 23-year-old male. I was diagnosed with PVCs, or the preventricular contractions, and they're just really bothersome at night. I can't really lay on any other side but my right side, or my heart feels like it's just skipping a beat. And I wore the heart monitor, and they told me they were benign, but it's just like causing me a lot of anxiety, and it's hard to sleep sometimes.
They cause you.
I also wonder.
We wonder. Go ahead. I wonder
if it will make my heart like weaken over time because it's just like skipping beats.
Yeah.
And I also wonder if there's anything to do to stop it because they're.
And so the anxiety is because you don't believe them when they tell you they're benign.
Well, I believe them, but it's like it feels like somebody like punches me in the chest.
Right. Okay, so here's what. So this is kind of interesting. So here's what that is. So premature ventricular contractions, here's the actual rhythm he gets. He's going along, bump, 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 and he gets an extra beat, then a pause, and then after the pause, a big beat. And it's that big beat that it makes him feel, like he's getting kicked in the chest. And it's actually during the pause that his adrenal glands will put out some adrenaline, some epinephrine, because your blood pressure kind of drops during that pause. And so your body has to do something to boost the pressure up. And that actually adds to the anxiety, right? So you have all this sort of biology of anxiety going on. At the same time, you feel that big beat at the end. And it's like, what's that? People get very preoccupied with it. So it's bump, 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 pause, bump, the big one. And the pause is unpleasant. The big beat is what people feel. And it is a nothing, historically, a nothing. It may be in the setting of a young person with a normal heart, okay? I'm prefacing it that way. If your heart is normal, these are nothing, 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 zero, nothing, zero, nothing. I've had them for years at a time. You kind of learn to get used to them. Now, having said all that, there's some new thinking on this, that if you have too many per hour over too long a period of time, there might be some association with some weakening of the heart muscle. It's not because of the pause. I don't actually even know why. I'm not sure I'm convinced of it, but this is what the cardiology board reviews keep saying now. So I'm gonna toe the party line. This is the standard of care. So we're going to discuss this as something that should be treated. And the treatment would be either a beta blocker or a calcium blocker, so something like atenolol or something like maybe cardizem or something like that, to try to stop it. The beta blocker is what traditionally we used. I personally would not want to be on a beta blocker all the time. It makes you kind of tired and depressed, and it can have side effects. So the medication is way more likely to be worse than the actual condition, which is benign, as we said. So there's that. However, I'm going to put a big however on this now, and this is the interesting part to me. We live in the world now of post-COVID, post-vaccines, subclinical myocarditis, and I've seen lots of people with all kinds of rhythm disturbances. Typically, they are supraventricular, meaning from the atrium, not from the ventricles. You have the premature ventricular contractions. The more concerning stuff has been supraventricular. But remember, I said premature ventricular contractions are completely normal in a normal heart. If you've had myocarditis and you have a focal area of inflammation, it might be a different story. So this has different considerations than it ever used to all of a sudden because of COVID and vaccines. So one of the things that I might do,
wondering about that.
Yeah, and so what I might do from somebody like you who's anxious and I'd like to reassure, I might go so far as get an MRI of your heart just to make sure there's not anything weird going on. There was just a circulation article that came out a couple of weeks ago that suggested that people that get myocarditis, regardless of the source, from COVID vaccine, this study was on vaccines, but I think it could be generalized. There's some permanent stuff going on in about half the cases. And in which case, I would treat these ventricular contractions, right? So this is the kind of nuance of situations like this. And then if it's negative, if that MRI is negative, then I would say, Aiden, calm the fuck down. We're not going to do anything here. I don't know what you don't understand about benign. It's benign, and that's it. And you're going to have to figure out a way to and maybe one day we'll get your anxiety disorder treated, not the ventricular contractions. Having said that, though, I can't say that with that kind of clarity anymore because of all this shit going on with the spike protein these days.
Okay. Yeah, I was wondering if you were going to mention that because I got a very a very early vaccine because I was in the military when COVID happened. So I got it and I'm a healthcare. I was a medic, so they pushed it on me as soon as they could. So
well, and I'm sure you've seen the data studies that showed some of the early batches. 10% of the early batches in Denmark was associated with 90% of the adverse events. That's one very good study out of Denmark.
Got it in Wow, yeah, I got it in December of 2020, I think. So it was early.
Yeah. Look, so you go talk to a cardiologist. He or she will address with you that issue of the too many premature contractions, myocarditis, which I bet they'll go, don't worry about it. But and they might just go ahead and treat you without the. I'd be interested to know, though, wouldn't you?
Yeah, I'd be very interested.
Yeah,
I worry about it a lot.
So say it. Well, that's your anxiety disorder. That's a different thing. But make that clear to the cardiologist when you see them. Okay.
Okay, I'll do.
Yeah, interesting. Thanks, Aiden. And let's see. Oh, all right, boys, I want you to help out with this one too. Ready?
Sure thing.
You got it, doctor.
And you guys can't do so much with ventricular arrhythmias, but this one you can help. Drake from Indiana. Drake.
Hey, Drew. So about 5 years ago, I was in a 2-year-long relationship, and I got cheated on at the end of it. And when I thought I was at my lowest, this girl really helped me put myself back together, and then we were together for about 3 years, and then about 3 weeks ago, I caught her cheating on me.
What do you mean? What do you mean caught? Hang on. What do you mean caught her cheating? What did you see or find?
I walked into her office in the house that we were gonna buy, and I saw on Discord, the gaming messaging app, a bunch of texts from this guy that were talking about what they'd do together, and she said that they had sent pictures back and forth and stuff. So,
boy. So, what's the question?
Well, so I was never intimate with the first girl because I was in high school, and she wanted to save herself, but we were very intimate and moving on with our lives, and we're about to buy a house and stuff. I just want to know if it's my fault if I just keep picking the bad people, or if I'm the problem, or
Yeah, of course. How old are you?
I'm 20 right now. She was 21.
Oh, buy a house together at 20?
Yeah, we'd been together for 3 years. She really rebuilt me. I thought it was perfect.
Wow. So you're still super young. I mean, you should be dating and figuring out who you are and what you like and what, how to even be able to assess, is somebody right for me or not. I don't know how you do that at 20. It takes a while to figure that all out. That's number one. So you may be kind of, sort of love addicted, really. You're falling into these relationships way too quickly, perhaps. It's great that you're wondering your sort of role in all this, because of course that's the only thing you can do anything about is your piece in it. So the second thing would be is how's your picker, or as you said, are you picking bad people? So one is sort of the boundary issue of falling in so quickly, falling in love with the person that's rescuing you and saving you and all this stuff. That's not the healthiest setup. And then who it is you are attracted to, of course, that's an important concern. 3, I would say these have been long relationships, particularly for young people. And I wonder if you were missing the signs that these things had run their course anyway. Were either of these girls saying, go ahead?
The first one I said wasn't intimate or anything, but and then, anyway, the first one, I've obviously way past that. But this last one, we hadn't been having sex for the last couple months, and we both chalked that up to her being on birth control, and I'm a little overweight, so we were assuming that had something to do with it. And then I think she wasn't into me, and it might have been a safety thing for her to. I'm sorry, I'm emotional about this. Maybe she was still sticking around because she knew I'd always be here for her or something.
Or maybe she had been, this person that was the rescuer. She couldn't be seen also to be the abandoner. She couldn't deal with that. herself. You know, sometimes people they want you to think of them as somebody that can save you, and then when you're saved, and they don't want to stay around for whatever reason, they still stay. So there's 3 issues here at least, just right off the top. You know, one is getting in too quick, one is picking the wrong people, and the other is staying in too long. And there's, you know, I'll just give it a 4 separate category. You're too young. You're too young to be sort of asking this of relationships. I don't know how you figure out what's what, you know, by 20. Boys, what do you think? I see some nodding there in Annie's part.
I mean, I guess the instant alarm.
What's up, Annie?
What's up, baby? But the instant alarm that I heard was that she like brought you out of this.
You're right.
She recovered you.
Right.
That's
Rescuing.
Kind of, that sounds good on paper, but that actually could build a really toxic relationship because you should be building yourself out of something like that. So, you know, as a man, something that, you know, one of the unfortunate annoyances that, you know, kind of, I don't know if ever goes away, is that you're not doing enough. And I would focus on that a little more in terms of like building yourself to be a better person. And whether it's, you know, you said you're overweight, maybe it's.
Yeah. I mean, this is let me, I think Annie's point is exactly one of the points that's really important, which is people that are rescued are now permanently dependent on rescuing.
Yep.
You're not actually building yourself. And that's I think part of too young also, which is you got to go date, feel what it feels like to bind and break and form relationships and figure out, you know, who you like hanging out with and why. I mean, it takes time to figure this stuff out. And were you abandoned or something when you were growing up?
Not really. The only thing that like really happened since like I was a kid was I guess my parents like started to separate, and I was around for like the beginning of it, and then they got fully divorced over COVID. So, but
you were,
I was like, I feel like I was old enough to not really be affected by that.
Yeah. What were
like,
things like before that?
Probably 3 years before. They really hid a lot of their fighting and arguments. But I was the first one out of my older and younger sibling to like find out that they were fighting a lot. So, but it was like 3 years before COVID.
All right.
So,
it just God, I could just there's so much of this. Chad, you got anything to tell him?
Yeah, I mean, I think it is just a youth thing. You know, it's in time, I'm sure it's hard now, but in time, this probably won't matter that much to you.
Well, that's a great point. I've said that to young people more than a few times. Like, we'll laugh about this one day. Tanner, you're more closer to his age. What do you think? Whoop, no sound.
Oh.
There we are. Now
I think you're just overthinking it too much, dude. Like,
well, but he's hurt, man.
Yeah, well, I'm a year older than he was,
Yeah.
and like I thought it was the end of the world when I went through my last breakup.
Okay,
But
keep
like,
going.
I moved to Austin. You know, you go out a little bit with your buddies, you have a good time, you meet some chicks that don't really matter to you. You know what I mean?
it just really hurts to this.
I didn't say that, but yep.
It was like 3
Treat
years.
some people like trash, and that's what they are. What are you gonna do?
Well, I don't know. Like, just take some time for yourself, man. And
Yes.
in the next, and, you know, the next go around, try to put some walls up a little bit. You know, not in a toxic way, but just I don't know. I try
boundaries,
to keep it.
boundaries.
Yeah,
You're right.
create some
Yeah.
boundaries. Don't be so vulnerable.
So what do you want to say, Drake? What are you saying?
I started working out like before we broke up because I was trying to like raise testosterone and stuff, so maybe I could like initiate more. But I've been really in it since we broke up, and I just thought it'd be cool to say I am down 35 pounds and
Good.
I'm building muscle and
Fuck
stuff.
Yeah, dude.
Fuck
I'm
yeah.
taking
Fuck
time
yeah.
to kind of put myself together.
Yeah,
So
congratulations. Look,
It really
do that. Do that. Get you need some people like Tanner in your life. Some dudes you gotta just go. Come on, let's go. Let's do some stuff. Let's have some experiences. I'm not kidding. These are not glib. These are like prescriptions. You need to go do the things. I don't know why you've been in such a hurry to fall into these relationships. Too much too soon. Don't be careful. When you come out of this, you could get angry. You could start mistreating women. Don't do that.
But that hunch is right, man. That 35 pounds you lost, I know you feel great about that, and that is the type of energy you want to keep around you. That's going to bring you further than any girl that's going to, say the right things and love you and whatever.
Yep.
Do it for you first, man. And then and then I bet you'll find someone by doing that.
I'm going to ask a very sort of TV question. How does it feel when the guys say this stuff to you? Because, and I mean it because, well, tell me first, how does it feel when people talk you up like that?
It feels good. I really haven't been able to talk to my friends.
Yeah.
Sorry.
You need a lot more of this, like a lot more of this kind of coaching up. Okay.
Hey, DM your boy. DM your boy on Instagram after this, bro.
Wait, listen. Hear what he said.
DM your boy on Instagram after this. I don't know how you going. I mean, just let me know. Just put like, this is from Dr. Drew. Just let me know. We'll talk.
And you're going to get 40 of those.
Yeah, I know.
It's Drake. It's Drake from Indiana.
It's Drake, yeah.
Drake from Indiana. And how will he know you?
Actually, give me your tag. We'll cut it out. Okay, I'll look for it.
All right, buddy. Do it.
Okay.
Yeah. It only takes, Annie, thank you for doing that. It only takes a few other humans to bring other humans out of shit. You know what I mean? Brains heal other brains. And it doesn't have to be anything heady where you were spending time with intimate, the stuff I do, the stuff I talk about. It can be just what Tanner just said. Let's go out and hang out with some chicks we don't care about.
Yeah.
Well, I wouldn't say it that way, but that's the way he said it. That is exactly what he said. And he's not wrong. But I be careful. Any of you guys ever come out of a period like this where you get angry with women afterwards?
You should probably care about them a little bit.
You should care about them as human beings. You shouldn't get involved, as he said. You put the boundaries up and you don't get so involved so fast. Just enjoy their company. That's all. It's okay to go enjoy people's company. That people whatever your sexual orientation is, people you might be romantically involved with, and not get romantically involved. Just spend time. Just enjoy it. I don't know. It's a weird time when people are like, they're either completely shut down or going all in all the time.
Yeah, I mean, I don't know. I mean, a bunch of things that can do that to you, but I mean, loneliness is a big one, man. Like,
it's bad.
You think that a relationship is going to take you out of that.
No, listen,
probably make it worse.
Yes, and if I could easily just point at anything like what Drake's complaining about and go, oh yeah, COVID did that to all of us. It just destroyed, particularly young people like that. Tanner, how was COVID for you?
I kind of had fun. I'm not gonna lie. I went out with my This sounds bad, but we would go on hikes. I started going cliff jumping a bunch.
So this is when you kind of got your shit together a little bit.
A little bit, yeah.
Okay, good. All right.
Try to be out of the house because I just didn't want to, too much time inside.
How did you end up here?
How did I end up in Austin? Well, before I moved here, I was living in a shipping container out in Dawes, Texas.
As is the custom.
And then decided that I wanted to try film and comedy, so I moved out to Austin, turned 21. I was like,
what were you doing in a shipping container?
I was ranching, learning construction.
Oh, interesting. Oh, that's you're welding, right?
Welding out there, yeah, building fence.
I think that's brilliant. I just think that if you don't know what else to do, go learn a trade or go use your hands. It's pretty simple. And I bet while you were doing that, you started, speaking of building each other up, that building Drake up, I bet it kind of helped you a little bit.
Oh, 100%. Yeah.
Yeah. So using your hands, working outside, all these things can just, the more we sit in a cubicle and the more we sit on our phones, the worse we're going to get. It's pretty simple. With HelloFresh, you get farm fresh, pre-portioned ingredients, seasonal recipes delivered right to your doorstep. We actually get excited when it shows up. No trips to the grocery store. Count on HelloFresh to make home cooking easy, fun, and affordable. That's why it's America's #1 meal kit. My son has been preparing the HelloFresh recipes. They've been amazing. We look forward to them. And of course, the holidays are right around the corner. And HelloFresh can take the stress out of dinner by delivering everything you need to cook up the tasty meals. They have it right at your door. Saves you tons of time. Spend time with your family instead of in the kitchen. If you're hosting this holiday, HelloFresh Market has just what you need to please a crowd without the hassle. From a photo-worthy charcuterie board to mouth-watering desserts, they've got it all. HelloFresh's ingredients travel from the farm to your door, so you know they're fresh. And everything arrives pre-portioned so you can get right to the cooking real quick. As I said, we're doing it as a family now. My son's kind of gotten into it. Go to HelloFresh.com/Dr. Drew free and use the code Dr. Drew free for free breakfast for life. Unbelievable. One breakfast item per box while subscription is active. That is free breakfast for life at HelloFresh.com/DRDREW free with code Dr. Drew free. HelloFresh, America's #1 meal kit. Let's take a quick second and thank our sponsor for today's show, which is Sheath Underwear. Sheath makes the most comfortable boxer briefs I have ever worn. If you're sick of boxers that are too loose or briefs that are too tight, Sheath is for you. They're the best. You have to get one pair, and then that's going to change your life. The most comfortable boxer briefs you will ever put on your body. The stretchy fabric is made with moisture-wicking technology. Super soft. They keep everything cool and comfortable and in the right place. And the most unique thing that Sheath Underwear provides is they have these dual pouches that keep your parts separated. If you want to use it, you don't have to, but it keeps things from sticking together and keeps them right where they need to be. Go to sheathunderwear.com and get the most comfortable underwear you'll ever wear. And if you use the promo code After Dark, you'll get 20% off your order. That is Sheath Underwear, SHEATH underwear.com, promo code After Dark for 20% off your order. All right, let's see. Can we go to some voice messages? I need to catch up on a few of those.
Sure thing. 1 second.
Let's do it, and then I'll do some emails. Your taint is burning. Yes,
sorry,
it is.
It's not a voice.
Oh, sorry.
You don't even understand how long Chad and I laughed at that. It was so...
The taint is burning?
You just said my taint is burning. It was just the way that you said it, the timing of you saying it, the fact that I switched to you right when you said it. It was just so many things layered on top.
What was that in response? I don't remember. What was that in
It
response?
was in response to a caller who said that his taint was itchy or burning or something.
I see.
But you said it like the British are coming, basically.
Yeah. And you like hit the mic. You're like, your taint is burning. It was, bro.
We were talking
taint
about
is burning.
Chad Goes Deep a couple of shows ago, and they make a whole line of comedy around sunning their taints, tanning their taints. Okay, taint is burning.
Legends.
Move on.
Hey, Hitler. I just have a quick question. Basically, I've been having this weird fantasy of being, like, on all fours and having my boyfriend, like, piss on my butt crack and vagina area. And I was just wondering if there is any, like, bad outcome of someone else's urine being in your butthole or vagina hole. Yeah, that's pretty much it. Piss on me, literally. Yeah.
I think I'm in love. She ran the cycle on all the great pronunciations. The vagina, the butthole.
I'm gonna need her to hit me up on Instagram.
Yeah, I was gonna say the same
That's
thing.
true. I think that's smart. Did she give her name? I don't know if I heard a name. Did she say her name at the beginning?
It says anonymous.
Oh, anonymous. Okay. So urine is largely sterile. I mean, for the most part, sterile. It certainly is not, laden with anything that's going to cause skin infections. So the skin is fine. It has a certain kind of pH and the uric acid in, the urea rather, that can be burny. It can be a little affect, delicate tissue like lining of the anus or the vagina. But it's not a problem in the sense it's not going to really do much. No, I can't see any problem with it. I don't know if that's what you want to do. I just go ahead. Most men aim to please, and though they can get we can get weird to go, no, I'm just not into that. I can't imagine. I can't do it. But most men aim to please. You ask for something like that, they will just go, okay, well, let's throw the tarps down. Let's figure this out. Am I wrong? Most men will just sort of whatever.
100%.
Yeah, and I don't quite know what it's doing for you. I find that interesting. Anybody have any theory about that? Why? She has a whole elaborate thing there. On fours, pee on me, got to get on the butt crack and the vagina.
I'm not sure, but I'm willing to do the research.
Yeah, but good for you. You know what you want. If it really works, I can't think of any reason not to have at it. Give me another voicemail.
Hey, Dr. Drew. My name is Tyler out of Colorado. Just got a question for you. Whenever I am making love to my sweet, sweet girlfriend in the morning, that's about how long it lasts. I say about sweet, sweet girlfriend, and I'm done. But if I'm making love to her at night, I can last a good amount of time. What is up with that? My neighbor said the same thing happens to him. We come too fast in the morning, can last at night. Is that a common issue? Thanks, man. Hope you're doing great. And hello to every booth boy there is.
Thank you, Tyler. It's not a common thing. It's not something that has come across my palate before, even that I can think of. Definitely there can be changes in sexual functioning and erectile functioning across date parts. But in terms of there being a dramatic change of the sort of duration prior to orgasm, that's kind of a new one for me. I just wonder if you do take any medication or anything. Is there anything else happening through the day? Are you masturbating every day or something that makes it, just wonder what else is going on that might be contributing to this. And it's more than just the time of day. Here, what does that say? Is there an answer to that?
Oh, that's just Reddit.
What are some reasons? Let's come really fast. Fast in the morning. Oh, there we go. There's 3 reasons why. Let's read it. This is Reddit. Accept. Yeah. I can't read it. It's too far away.
Says men's testosterone levels are highest in the morning.
Yeah, that's true. That's true.
High recharging, horniest in the morning, but also.
I was gonna ask if it is like, because if you wake up with morning wood, sometimes it's like, what if you've just been rubbing the whole? You didn't even know.
The morning wood itself can be associated with stimulation, right? And the wood, as I've explained, comes from 2 or 3 different things. One is a bladder distension. The other is the spinal cord reflex from the bladder distension. The other is sort of how our lymphatics and the venous system drains once there is an erection from the other mechanisms, and. Yeah, I mean, certainly prolonged erection can be associated with arousal. So I think that might be that. I think Eddie's onto something with that, because that makes some sense to me. There may already be increased sensitivity by the erection being present, morning wood, so to speak.
I kind of have the opposite, I think, because with like morning wood, it's not really about being like. It
doesn't have to be. It can be uncomfortable.
Aroused. It's more like, blood flowed there overnight, and here we are.
Correct. And again, it's spinal reflex and all that stuff. But I could see where some guys it could be a thing. I could see where it could be a deal.
I just know for sure there's some mornings I wake up, I'm like, oh, we going. This happening right now.
Yeah, it's got to be quick too.
It's different, yeah.
Yeah, I could see that. Yeah, and that's, if you're an everydayer or a couple time a dayer, those are the guys that are going to have that kind of thing. All right, breast milk still flowing. 25-year-old female had a daughter 6 years ago, breastfed for around a year. Haven't had any pregnancy or miscarriages. I'm not on birth control. I'm healthy, 150 pounds. 3 years have gone by, and if I squeeze my breast, I still express white breast milk. It will shoot out pretty far. My husband does not squeeze or suck on them extensively, so I don't think that he's stimulating production. She's looked into all this. This is good. It's not really something that concerns me per se. I'm more curious why it hasn't stopped after 3 years. I figured the milk would eventually dry up. Your milk is dried up. You're still producing a small amount. But I mean, that's just the way. It's not like she has a full production of milk. It's your taint is burning. The taint is burning. So there can be several things. One is sometimes this just happens, number one. Number two, just the irritation of the nipple against the bra kind of thing can kind of keep things going, even though he's not doing much stimulating, and usually it's a partner that's doing that stimulating that keeps things going. 3, medication. And I think you said you're on no, not on birth control, but I don't know if you're on any other medication. You don't tell us that. And then number 4, there can be pituitary tumors, so you might just get your prolactin level checked just to be sure. Pretty healthy 23-year-old male, did a lot of porn, 12 to 18, still watch a bit. Always have dealt with erectile dysfunction. Can't seem to get it up with a woman. I used Viagra every time since I was 18 with a woman. Are there any health problems with this? And is there any way I can fix this? Interesting. So it sounds like he has success when he uses the what are called PDE5 inhibitors, which is the Viagra and Cialis, that kind of stuff. And usually when guys have a confidence problem and they use the PDE5 stuff, and it gets them sort of over the hump, so to speak, on their confidence, they can usually back away from the PDE5s. But he says he's still dependent on them. So it's not an emotional thing he's not obviously emotional. somebody needs to explain why he's having erectile dysfunction. He's 23 years old, having erectile dysfunction. That needs to be explained. I don't know if he's smoking a lot of weed. I don't know if he's smoking cigarettes. I don't know if there are things, drinking a lot of alcohol. All these things can affect erectile dysfunction and need to be evaluated. In terms of health problems, you get more esophageal reflux. We've been talking, this is our reflux show. Taking those medication, it loosens the muscle between the esophagus and the stomach and can cause the acid to go up into the esophagus. It is associated also rarely with some eye problems. And so, as a young person, we don't necessarily want you exposed to a lot of that. Beyond that, everything else is obscure side effects. But, you don't want to be taking medication if you don't have to. Young people should not be on meds. 24-year-old woman diagnosed with polycystic ovarian syndrome. Doctors did not offer any sort of treatment plan. I'm wondering where I should go from here. My diet is decent. I work out regularly, but I still have constant bloat, belly fat in my lower abdomen. How do I control this? Well, a lot of people use metformin with people with PCOS. Also, if there's painful menses or significantly irregular periods, you might go on some hormonal contraceptives to try to get the cycling stabilized. There are some dietary ideas out there on how to help with PCOS, but it is one of those chronic conditions that is very common, and a lot of ideas about what can be done. Let's see if there's anything new out there. Just really quick, just so I'm updated too. A picture of Macy Bookout just came up on my Twitter feed as I was looking here, and she's one of the teen mom with PCOS, interestingly. Letrozole. New research found that Novartis' aromatase inhibitor currently appears to be more effective. Okay. Sensitizers such as metformin have long been used, right? SGLT2 inhibitors, which is sort of, let me see what the common names of all those are. I don't want to misspeak about that. So that's interesting, and that makes sense to me. That would be a new way of going at this. Yeah, Jardiance, Invokana, Steglara. This is another sort of diabetes medicine. It's in the Jardiance is sort of the more common one. That's interesting that this is now something that is being used. It's a sodium glucose transporter inhibitor, SGLT2. So that's interesting. So the SGLT2 inhibitors might be a new treatment for PCOS. Definitely talk to a doctor who has experience with that. Stephanie from Canada, a question about my period. I'm 35. I always had problems with my menstrual cycle. I used to have them for weeks to months. Now I have them every 3 months. I don't know quite what that means. So, but except they're getting longer. After I had my son, they changed to 3 months. All right. I've been noticing more facial hair, which is annoying. Does this have anything to do with my cycle? Yes. And by the way, PCOS commonly can do that too. So that's something that's a possible mechanism there. But yeah, you may be having anovulatory cycles. You may be sort of overweight right now too. That can be associated with all of this. So please do talk to your gynecologist about that. Nicole, what's going on?
Hi, Dr. Mommy.
Hey, Mommy.
Okay, so I'm a nurse, so I know how much doctors love patients taking forever to get to the point, so I'm going to get right to it.
You're so funny. It's so true. It's so true because patients, what's embedded in that is patients don't know what's important. They think that everything they're telling you is super important when we need to know just very, very specific things usually. So go ahead.
All right. So I'm always thirsty. I drink about 8 to 10 gallons of water a day. And that's like limiting myself. My lab values have been normal. But over the past year, I've noticed my urine smelling really foul. And I know you're thinking like STD, UTI, both of that is negative. Could my water consumption have anything to do with kidney function and my urine smelling weird?
Are you on any medication?
No medication.
No supplements?
Nope.
Okay. No birth control pills, no nothing. Zero, nothing.
No,
okay.
Nothing.
Okay. So one of the things that can happen with some people is they can actually get a washout of their collecting system, concentration system. And you send so much water through that you actually wash out the gradient a little bit. So the effect is not as efficient as it should be. So it sort of feeds on itself. You have to kind of back off for a while and let it kind of equilibrate. It will automatically on its own. It takes a couple of days. But if you're not putting out so much urine, you may not be as thirsty. Obviously, the other possibility is that the ADH system is off for some reason. Why would a healthy person have that? I can't think of any reason that you would have concentrating problems, and unless you've been having this for a long time.
I've been consuming that amount of water for 3 or 4 years.
Yeah,
and the urine smell has been the past year. So I'm
the urine smell thing,
my water.
Yeah, the urine smell thing I can't explain. That's odd because usually when you have dilute urine, it smells less. It's less smelly, right? You don't eat asparagus every day or something strange like that.
Nope.
No.
Nope.
That the smell is the oddest thing that you're describing of all. Have you had any
like that ammonia smell?
Yeah. Because again, it makes me think about whether or not you have a disorder of your concentrating system, which is making the urine less dilute, highly concentrated, but more volume. That's an odd. Have you ever seen a nephrologist about this?
Would you suggest like an ultrasound? I went to a nephrologist and he made me measure intake output. That was normal. Would you recommend like an ultrasound of my kidneys to see if something's going on?
See, I think I'd go. I can't think of anything structural you're going to see in a kidney. Let me think about this. Do polycystic kidneys? Did anybody in your family have polycystic kidneys?
No history of kidney issues.
Because there's something called
not diabetic.
Right. There's something called polyuric renal failure, where people go into renal failure by exactly this thing you're talking about. But those are. Let me look that up. What conditions cause that? I'm sure you've been down this road a lot of different ways. I mean, what are you thinking it is? What are you worried it is?
Some type of tumor. That's why I was thinking ultrasound. Pituitary gland. I don't know.
Yeah, the pituitary is what I'm thinking about. Kidney infection, they say. Well, you'd know about that. Diabetes insipidus is the one thing. There is central diabetes insipidus, and there's nephrogenic diabetes insipidus, right? And that each of them has a different workup. Okay. How to diagnose? Did they feel that your urine was too dilute?
Yeah, because when I was in nursing school, they made me take drug tests. So every test that I took, it came back as like too diluted, like I was tampering with the drug test.
Yeah.
And I'm like, no.
So ADH, right? Antidiuretic hormone would be the thing to test. MRI would be the thing. So yeah, it'd be ADH and MRI would be the sort of starting points. But that still wouldn't rule out nephrogenic DI, right? And so you should, I would stay with that nephrologist and keep going. I've learned, you talked about frustrations that physicians have with patients that don't get to the point. The other thing I've learned is when somebody feels that something isn't right, I know not to ignore the patient also. So I would say make sure you get proper attention, okay?
Okay.
All right, let's see. It'd be very interesting to see what this is. And by the way, it might just be you, of course. It might just be your sort of genetic kind of makeup that you're sort of set up this way. And I also would do what I said earlier too, was try to back off on the amount of water intake and see if your collecting system doesn't kind of re-equilibrate itself a little bit. It's certainly something worth trying before you go into a multi-million-dollar workup, okay?
Okay, will do. Thank you.
You bet. All right. Let's see some videos, if you guys don't mind, and get some more voice messages.
Yeah, we don't have too many more videos for you. We have one more medical video, but then we do have more voicemails too.
Okay, and I don't get to see any fun videos from Christina's collection of rogues.
Well, what have you been seeing?
I don't know. I just see a lot of TikToked folks out there. She's sort of fallen into. You've seen all that? Eddie saying, yeah. She's some people with.
I'm just laughing at your terms.
Strange
your scientific term.
Well, I could just say talked. It's just some strange types out there. I know we're getting into. You know what it is? it's when I start feeling bad for people, I know that she's in full form. And I look at her Instagram now. I just start going, oh God, why are we looking at this? I feel bad for these people.
You know what? I do have one really stupid, weird question.
Oh, that's always good.
So remember I told you I had that clicking sound in my throat. Sometimes I wake up,
yes,
or after sex, I can hear a clicking.
Yeah.
So that happened again, like whatever, maybe a week ago or something. So I recorded it. I'm sure it wouldn't play, like it's so low that it probably wouldn't play through the mic, but you can hear it. I'll show it to you after the show, and you hear like a clicking. And so I was like, that's so weird. And so I started moving my body just to see, like, is there some part of me that if I move it makes it worse, or like it gets rid of it? And then I moved my arm, or like my shoulder, like forward, and I like gasped, like I exhaled, and I was like surprised, because I'm like, wait, I didn't just do that. Did I just do that? And so then I just did this, and like I'll do it right now. It's gonna sound crazy, and I'm gonna look fucking stupid, but it's okay. Check
Can't wait.
Out. So you move, like, not your torso, just your shoulders forward and back. Hold on, let me see if the mic will pick it up. That looks so fucking stupid, but did you hear that?
I did.
I'm not doing that. I'm not exhaling. I'm not.
I wonder if you're. Gosh, I've seen almost an epidemic lately of phrenic nerve problems. Believe it or not,
what the hell is that?
It's a COVID thing, I think.
Oh Jesus Christ! What the fuck is not COVID?
Well, the phrenic nerve is the nerve that kind of controls the diaphragm, and there's been varying degrees of dysfunction of that. You would sort of identify it with a chest X-ray if you see the diaphragm up on that side. It kind of is a sign that that's going on. It's if you're not having any symptoms from it, right? I wouldn't make anything of this.
I mean, other than feeling really stupid, no symptoms.
Yeah, it kind of makes sense to me. It might go along with the kind of clicking kind of thing, because it's just an odd little deal. I'd want a chest X-ray. That's what I would want. Just to kind of, it's kind of an interesting thing.
I asked everybody around the office just to do it. Just that everybody looked stupid one day. And, there was one person, Alan, who, like, there was a little exhale, and I was like, you see, he did it too.
Well, what makes me wonder, it makes sense to me that this is a way to force your diaphragm to move a bit, and if it's up higher than it should be, it would move a bit of air like that. You see what I'm saying? And so that's what I'm kind of worried about. And it may just be you, maybe normal, just like Alan was normal, but the amount of air with the weird clicking and stuff, and it started kind of recently. Are you fully vaccinated and everything?
Not fully.
Okay.
No.
Did you have COVID ever?
I've had it like 14 times.
You're right. So it makes me worry about that.
And my lungs have always been shitty.
Yeah.
I don't know if that has anything to do with it. They also told me I had asthma as a kid. And
it could be asthma. Maybe it's just a little, it could be, it's something called pulmonary reserve. There's part of your lung that doesn't expand when you inhale. And maybe that's kind of, asthma can make that a little bigger than it should be. You get some obstruction and some air trapped in there. And so maybe you're releasing the trapped air. I don't know. I would do a little bit of a evaluation. It's kind of interesting.
You have been smoking with me.
Oh, yeah. Whenever you offer me one.
He's back in it.
I'm down, man.
He's back in the game.
I'm down. Hey, it's cool. You know what I do like about it is that it forces you to take a break. That's one thing that was actually cool about smoking, was that it forced me to go outside and stop. Because when I work, if I do anything, I don't stop. It's just nonstop. Go.
Is that better, taking a break?
For sure, because fucking, your brain takes a second to slow down and think about what's going on around you. And
what's interesting is I said that exact same thing, and you gave me shit for doing that.
I don't recall.
It was on the show. It's recorded. We can look it up.
No, I believe you. I mean, I also just like giving you shit, so that makes sense.
But you're still in the zone where you can start or stop cigarettes at will?
Oh, I mean, 1,000%.
Okay.
Yeah.
All right.
1,000%.
Yeah, me too.
Yeah. All right, it's your voice message.
Hi, Dr. Hitler.
Hey.
I've noticed that anytime I have a sore throat, if I just happen to swallow some cock, it seems to help that issue. So just wanted to know if there's any science behind that, or if, it's all placebo effect in my head that, sucking a little dick will cure a sore throat. Piss on me, beat me, and you bet your ass I'll be coming up in May. Thank you. Bye.
Again, we don't know, but I'm ready to do the research.
That's exactly what I figured. Yes. I was going to say, certainly there's no way do I want to discourage this, because if it works, great, and also her boyfriend would kill me. So I'm trying to think of possible mechanisms, but this is back to what I was talking to Nicole about. If there's something happening and you're really clear about it and it's really happening, I may not be able to come up with the mechanism, but good for you. You know what I mean? Placebo, I mean, sore throats are a pretty distinct thing. And by the way, let's put it this way. Next time you do it, all right, next time you look and see if you have redness in the back, and you're gonna have to maybe even take a picture of it so you could distort what I'm about to say. But if there's significant redness or even ulceration in the back of the throat, and then you do your thing, and that gets better, there's not much arguing with that. I imagine I can't think of what soothing chemicals would be in there. There's cytokines in there, I guess, and maybe cytokine application would. I don't know. They're pro-inflammatory usually, but I don't know.
Maybe her boyfriend's using some kind of
cortisone.
Yeah, some kind of numbing agent of some sort.
Yeah, that's an interesting thought. So maybe she just thinks she feels better. Well, I'm assuming she's saying that the whole thing resolves, like the sore throat goes away. I don't know. Give me another one.
Hey, Hitler. I recently started dating a beautiful woman from your land of Germany. We were recently doing our thing, made light, looked down, saw red, lots of red, and was very confused because she has an IUD, so she's not supposed to get periods, to my knowledge. She said she was not on her period and that she wasn't in any pain from this. So I'm just really confused as to what happened. Hoping you can enlighten me a bit here. Is my dick just so huge that I managed to hit the IUD and rupture something and somehow cause her to bleed? Let me know what you think. Ta-ta there, retard.
No, she had mid-cycle bleeding. She had some uterine lining instability, which the IUD can do. People with IUDs still can have periods, depending on what kind of IUD is in there. And it's, the uterine lining is built up. She will probably have to talk to her doctor about it, because that buildup sometimes can be, it's usually only a problem in postmenopausal women. But and I'm assuming we're not thinking the red came from you, right? Hematospermia is a pretty common thing, and it's another opportunity to say that that's a common thing, and it's benign in the vast majority of cases. But I usually do make urologists look at the guys who get that, which is, again, common. So yeah, uterine mid-cycle bleeding stirred by sexual activity, very, very common. And the IUD doesn't make it impossible. So, all right. Did I see all the videos? Is that it for the videos for now?
We have one more.
Yeah. All right. So he seems somewhat smug with his assessment here. What this says is a 24-year-old female comes to the ER, says, my heart is racing. She also says she feels short of breath. On further questioning, she has had 3 dark black stools, which is a black stool is a sign of bleeding in the gastrointestinal tract up high, like in the stomach or esophagus, or even the duodenum. She also tells you she uses ibuprofen every day for back pain. What is your top diagnosis? Well, he is going for, something obvious, and the obvious thing would be upper gastrointestinal bleeding. The non-steroidal anti-inflammatories very commonly cause erosion of the stomach and gastritis and bleeding, or esophagus and bleeding there. Remind people also, they're also a very common cause of a variety of kidney dysfunctions. Interstitial kidney disease, kidney failure. Please limit your use of non-steroidal anti-inflammatory agents like ibuprofen. So this guy is saying, oh, I know what this is. She's bleeding from her stomach. She's had the black stools because that's a sign that that's the case. And her blood count is down. That's why her heart is racing to compensate for the low blood count. And she's short of breath because her hemoglobin is going to be like 7 or 6. Yeah, that's obviously the case. Or that's not what's happening. Maybe she's having a panic attack and she's also someone that takes iron supplements. And that's why the black stool. So the one thing, his sort of certitude here is what I'm actually addressing, is that you can never be certain of anything. You can certainly think you know what the answers are, but in clinical medicine, things often go very different than you expect. So always have backup considerations in your mind, which is what I used to hammer at the residents about. You were shaking your head, and is there something I was saying? Are you just talking?
Yeah. Oh, yeah. Yeah.
Okay. I think I'd love to do another voicemail if we could. I think we're out of calls here. Voice message would be great.
You got it. 1 sec.
Hey, Dr. Hitler. Quick question about retrograde ejaculation. If, let's say, one were to do that and it lowers their sperm count, because testosterone and sperm are built in the same spot in the testes, could that also decrease testosterone production later in life, like it can fertility? Anyway, you bet I'm coming up in May. Keep them high and tight.
Okay, I'll answer his question in a minute, but you bet I'll be coming up in May. I saw some pictures of him with his boyfriend. I think I saw that on Christina's Instagram of Ed Asner with his boyfriend. They were in a pool. They were putting suntanning lotion on each other. They looked very happy. I actually was happy for them. And then I was sad for the guy that lost Ed Asner. I guess he's passed away since then. But it was weird because I had a whole new sort of take on You Bet I'll Be Coming Up in May. It was sort of hard for me to watch. And then knowing somehow that he ended up in this great relationship with somebody he really cared about, it sort of all kind of seemed okay to me. I know it was a very weird reaction I had to it. You guys know what I'm talking about? Have you seen him with his boyfriend?
I have not seen.
I haven't seen it.
They have the same body type. Let's just say I see why they're into each other. But to his question, I don't know what the hell he's talking about. Retrograde ejaculation just means the semen goes into the bladder. It doesn't go into the body. It goes into the bladder. Now, the bladder is a sterile space. It's sort of inside the body. It's not really outside the body like the vagina is or like the GI tract is. It's a sterile environment. And I guess some of it can get absorbed there, but nothing hormonally is absorbed. Just the proteins are absorbed and that kind of thing. Otherwise, it comes out when you pee, and then it's outside the body even more. So I don't know what he means about that somehow this is going to suppress testosterone or suppress sperm production. I don't know what he's talking about. There's nothing like that happens. So do you guys know what he's talking about? Did I misinterpret what he was trying to say? No.
He lost me at retrograde ejaculation. I was just picturing, what is that?
That's the first time you've heard of that?
Yes.
I've heard both those words, just not
together.
together.
You've heard me talk about it a million times, Eddie. Well, you were dissociated when I was talking about it.
Perhaps. I don't know.
Retrograde ejaculation is a very common thing. Some guys have it chronically. It's caused by medication typically. When you ejaculate, there's sort of a valve that goes that sends the sperm out the penis and not back up into the bladder. It's hard to do it with diagrams. I'd have to literally walk up to the diagram to show you. But let's just say the valve closes, the semen comes out of the seminal vesicles, comes out the semen, and if it doesn't close properly, it can go backwards into the bladder. Right? You see how they're right next to each other there? And it can easily just go back into the bladder. And if it's doing that sort of chronically, you can get into a fertility problem. Not because your sperm count is lowered, it's because your sperm isn't coming out into the vagina. It stays in the bladder. And in guys that have that chronically, it can be an issue. They have to figure that out. There's medications to help change that valve a little bit. But that's not good. That's a problem. The feeling of ejaculation is exactly the same. Just nothing comes out the penis. Huh? You guys got it? No, Chad, no.
I got it.
Chad, I see you looking confused.
Yeah, I just can't imagine it feeling the same as it.
Dude, I have no fluid and it feels the same.
Okay.
Oh. Should I drop the mic now? Hey, where the fluid goes, whether you have fluids, is separate mechanism from the from the actual orgasm itself. Skankfest, gentlemen. So just to wrap up, so I told you the story about Stanhope peeing and then drinking his urine on stage. That became one of the sentinel moments of the event. The other one was Joe LaRosa getting a... am I saying his name right? DeRosa. Joe DeRosa having a oral sex with a transsexual individual.
That's right.
And I could never figure out... everyone's told the story a million times. I still don't know. Was it a female to male or male to female? I don't even know what direct.
Male to female.
So it was a female.
Male to female because he jacked him off, right? That was a thing? Like,
yeah, that was part of it.
Took a load.
Yeah.
Yeah.
Well, it could have been a male. Female to male.
Female to male. Oh, right. Like post. Yeah, I guess so.
I assume he would. So that was the other sentinel moment. But the other thing that I talked to you guys a little bit about a couple shows ago that was just an extraordinary moment was all the skanks with Roseanne Barr and Violent J. Do you know who Violent J is? Do you guys know him?
Mm-hmm.
The ICP?
Yeah.
And ICP and, the Juggalos and the Skankfest, the Gathering and the Skankfest, they're sort of I think the Skanks were inspired by the Juggalos. And it really was nice to see Violent J there. He was in rare form. He was tripping on mushrooms. And he was very grateful to be there. And he goes, Roseanne, why are you so crazy? He goes, I need to know. And she went on about how she'd had serious mental illness and she finally sort of found a spiritual life and decided to lean into everything. And, it kind of worked for her. Her mental illness sort of symptoms subsided and she sort of embraces her craziness. You remind me a little bit of Doug Stanhope's wife, his partner. Are they married? Bingo. Bingo's had some issues and they just live their life. They are just human beings with certain conditions, and that's that. I fully endorse that. As long as the symptoms don't affect functioning. If they affect functioning or the ability to sort of live in your home or you end up on the street, then we need some treatment. But if it's stabilized and you're able to live with it and function well, good. You're just another interesting person. All right, that's my public service announcement for the day. You guys have any questions about the gang? Oh, actually, Tony was up there too. Tony Hincliffe was on that same panel, and he was. Yeah, there it is. Oh, there they all are. There in the that one. That's everybody. You can't see Dave Smith very well in that one.
Is
right?
that you?
Yes, that's me. That's me because. They very kindly set up a place for me in the audience a couple rows back. And, they started talking about getting deep into their drug talk. And, all of a sudden, I think, Lewis said, look at this, Drew's in the second row. Wonder what he's thinking. And Violent J went, holy shit, Drew's here. Oh my God, you get up here. You got to be up here with us. And so that's, they dragged me up. That was toward the end of the show, thank God. So, and it was nice. It was fun. I'm gonna do an area with Roseanne. We got to get Roseanne in here. Wouldn't that be interesting? Right?
It'd be pretty dope.
It'd be dope. Fun. Let's work on that, everybody. All right, that's our show for today. We appreciate you all being here. Again, voice messages 818-253-1693. Keep an eye out for the call-ins. That's 818-797-9959. That's for the live calls. We'll send that out on social when we're taking live calls, and of course these emails. DrDrewAfterDark@gmail.com. We appreciate you all being here, part of the show. Booth Boys, thank you so much, gentlemen, as always. And we'll see everyone next time. All conversations and information exchanged during participation in the Dr. Drew After Dark podcast or interaction on the DrDrew.com website is intended for educational and entertainment purposes only. Do not confuse this with treatment or physician medical advice or direction per se. You must always follow your medical professional's advice and direction. Nothing on these podcasts or posted on this site supplements or supersedes the relationship and direction of your medical caretakers. Please understand, I am not playing the role of physician in this environment per se. I'm educating. I am a licensed physician with specialty boards in American Board of Internal Medicine and American Board of Addiction Medicine.